we're trained that we're going to finish our training and take care of patients until we retire. But there's so much more that you can do, and our careers are not really linear when you really think about it. Just how you plan for retirement, you have to plan for a career transition or pivot. And there are trade-offs.
Welcome to the Physicians and Properties Podcast, the show where we teach you how investing in real estate can give you the freedom to practice medicine and live life how you want.
Doctor! 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 Doctor!
Now, here's your host, Dr. 𝐓𝐢𝐦𝐻𝐿.
Hello, everybody. Welcome back to another episode of the Physicians and Properties Podcast. Today's guest has a story about resilience, reinvention, and redefining what success can look like in medicine. Dr. Bertina Hooks is a board-certified internal medicine physician, a healthcare executive, an entrepreneur, and the founder of Pinnacle Business Academy. She helps physicians navigate burnouts, career transitions, entrepreneurship, and opportunities beyond the traditional clinical path. But Bertina's perspective on all of this is deeply personal. After surviving a life-threatening medical crisis, she was forced to reevaluate her own identity, career, and priorities. Today, she's intentionally built a portfolio career that includes clinical medicine, coaching, telemedicine, healthcare consulting, entrepreneurship, an author, soon to be, podcasting, and more. Her story is a reminder that sometimes what feels like the end of one chapter can actually create the opportunity to build something better. Dr. Hooks, welcome to the Physicians and Properties Podcast. So glad to have you here.
Thank you so much for having me here, Alex.
Absolutely. Well, I was going to say the pleasure is all mine. I'm really grateful to have you. Bertina, do you mind taking us back to the beginning? What drew you into medicine?
So my origin story into medicine is kind of interesting. My mother was a nurse, and so was my maternal grandmother. And when my mother was pregnant with my younger sister, she went into premature labor. And my sister was born premature, 4 months premature. She was the smallest infant in Iowa at that time. Wow. And so she had to be life-flighted to a NICU at the University of Iowa hospitals and clinics. And seeing how the medical team, I was like 6 or 7 at the time, taught us about my sister was in an incubator. She was on a ventilator for a while. She was getting tube feed. She was very critically ill. And seeing how the NICU team took care of her, explained things to us, gave us comfort, support during one of the most difficult times in our lives as a family, really kind of motivated myself to say, I want to help people like that. I want to be there in their most vulnerable situations or times and really make an impact, really make a difference. And then there was another pivotal point in my life when I was a teenager. I was coming back from a softball game with my best friend, and I was hit by a drunk driver in broad daylight. Thankfully, I did not sustain any significant injuries, but I did pass out for a little bit. I had a few, bumps and bruises, abrasions, things like that from the hit and run. But I went to the emergency room. And I saw how the emergency room doctors and nurses took care of, patients with different levels of acuity of issues, right? Some more serious issues like me, some maybe less serious. And I kind of told the charge nurse and the ER physician, I think I want to become a doctor. And so they gave me a stethoscope. The physician that took care of me gave me a blue metallic stethoscope that I still have this day. So wow. Those are some of the memories that I have that said, I want to help people. I love math and I love science. What can I do with that? My father was an engineer. He's retired now, but he always wanted me to become an engineer. And so I made up my mind pretty quickly around 5 or 6 that I wanted to become a physician. And as I got older, he was like, you don't want to be a engineer like me? And so I was like, no, Dad, I think I have a different path. And so I've always wanted to help people. I always wanted to be a physician. And so, along the way, obviously there may be setbacks, but I always felt like this was a destiny, a calling for me. And I really enjoy what I do every day. I feel like I was made to be a physician, and it's something I don't regret. So that was what interested me into medicine and kind of, propelled me into pursuing medicine, were pretty much those two pivotal, moments in my life. And then, obviously, practicing medicine every day for the last 15 to 16 years has only been fulfilling for me. Every day I get up and I get to take care of patients. I get to make a difference. I work primarily as a hospitalist, but I also have an outpatient. I've had an outpatient clinic at one point in my life, and I've done other, dived into aesthetics and occupational medicine, telemedicine, as you mentioned. So I feel like, all of those things make you a better clinician, right? All those experiences help you, give you that experience, that know-how to understand medicine better. And initially, I matched into an obstetrics and gynecology residency. And so I really wanted to do women's health. And then there was an experience when I was in my internship year that made me think, I want to really go into medicine and maybe do like critical care or cardiology. And so I redid the match after my intern year and matched into internal medicine. And that's how I started doing what I've been doing for the last few decades.
Wow, what a incredible journey. How is your sister doing now? How did everything turn out after that NICU stay, being the most premature baby in Iowa for quite some time?
Yes.
How did that turn out?
Well, it turned out well. She was in the hospital for a while. I think 4 or 5 months before she was able to be released from the hospital.
Right.
But she's doing great now. She's in her late 30s, early 40s. She's thriving. She's the VP of a company. No real residual deficits, because a lot of premature babies sometimes can have issues with meeting certain milestones and things like that. But she's doing great. Thank you.
That's amazing. Yeah, absolutely. Yeah. Was that part of the initial driver for you wanting to do OBGYN, you think? Or
Yeah, I think my mother's, obstetric issues. Yeah. She went into preterm labor and all of those things kind of made me interested in it. I think women's health, being a woman myself, was something that interests me. And I really wanted to do perinatology, which is high risk OB, and, kind of help manage diabetes and other medical problems. So that being an internist is not too far from that. It's just that they're not pregnant. But you still deal with all of those, chronic or acute medical conditions. So.
Yeah, absolutely. It sounds like a good blend for you with internal medicine and kind of jack of all trades, especially given the multiple different, clinical paths and avenues that you've had over time in internal medicine, which is really cool. Was there ever a point in time where you felt like you built the career that you were supposed to want, but maybe not necessarily the life that you wanted?
Oh, sure. I was very excited to finish residency and start as an attending, like most physicians are. And, you realize there's a steep curve, learning curve when you're coming out from residency. You're learning so much, every day, taking care of patients, on your own. And so I think 4 or 5 years into my career is when I started to feel burnout. Some of the signs and symptoms of burnout. I didn't feel as fulfilled. I didn't feel as restored when I, would be off service as a hospitalist. And I started to realize that I really had achieved a lot of the things I wanted to achieve in my career. So what was next? And that's why I kind of transitioned into locums for a little bit, just because I had more autonomy, more flexibility in my schedule. At that time, I also became a mother. So, I wanted to kind of, not necessarily be employed. I had always worked as an employed hospitalist before that, but I really got to explore, working with different patient populations in different areas of the country, dealing with learning how to negotiate my worth and understanding what my worth is as a physician. And I think that was a unique experience because I started to realize that my expertise is a commodity. It's a resource, and how we look at ourselves, our value is a lot of times determined by productivity and other things, patient satisfaction scores, but also we bring a unique skill set, and so understanding that and understanding, what that means, and your value and your worth, looking at it in a different way as a locums physician was something I think that kind of helped me start broadening my horizons and looking into other streams of income and entrepreneurship, actually.
That's awesome. So locums is kind of the pivot in your mind of like, hey, I'm starting to have more control. I'm starting to be able to have some power for negotiation, maybe a little bit more autonomy. What did things look like for you after you started getting the entrepreneurship bug?
Well, then I started my own practice. I started my own medical practice, and I started doing more consulting at that time. And that's when I really started to kind of get the entrepreneurship bug. I realized that I really enjoyed, being an entrepreneur, which I really think is someone who sees a problem and then provides a solution, a product or service or whatever that helps resolve that pain point or problem. So when I was a consultant, I was, helping with, coming into different practices, maybe analyzing, seeing what worked, what didn't work in the practice, and giving them solutions on, provider retention, compensation, workflows, EHR workflows, and things like that. And then that kind of forayed into me starting my own practice as an outpatient physician because I wanted more stability. My daughter was becoming elementary school age, so I wanted to be home more and not traveling as much as a locums. And then that's what really started me going into coaching. I started Pinnacle Business Academy around that time because I really saw a need for physicians were asking me, well, how did you build your businesses? And so I started, coaching others on how to do that. Because there's a lot of things that we don't learn about in medical school about the business side of medicine. And so those are skills that I kind of learned on the job. And eventually that's what led me to go and pursue my MBA because of the fact I really wanted to have that business acumen and knowledge, behind what I was learning every day and applying every day. So.
That's amazing. Yeah, I definitely want to dive a bit deeper into your businesses and your different alternative income streams. I know that there's a medical crisis that really kind of changed everything for you.
Yes.
Are you willing to share a bit about that and how it impacted your life?
Yes. I mean, it made a big impact on my life, and I think for the better. I know that may sound odd for me to say that, but I think if I continued along the path that I would have been, I really had become engulfed by my career and my identity as a physician. Even though I was a mother, I was an educator, leader, I really was, everything was tied up into my role as a physician. I didn't really provide enough self-care and boundaries for myself to protect myself. I didn't say no. I was always someone who was saying yes. If there was if my employer or my boss was asking me to do something, even if it didn't work out or even if I had a schedule conflict, I didn't want to let my team down. And so in December of 2022, I was actually hospitalized for necrotizing fasciitis due to strep, and I was septic. I didn't realize that. I had actually worked a shift that day, admitting shift, goodness. Believe it or not, and then came home not feeling very well and passed out in my bathroom and had to call 911. And so I knew something was wrong, but I just didn't know what. When the sepsis alert was called and the ER physician came in and was kind of explaining what was going on, obviously I understood that because I'm a physician. I worked as a hospitalist for years, had admitted many patients in sepsis, but it's different when you're on the other side being the patient and realizing what that means for you. And then realizing that I needed a right below the knee amputation in order to save my life. And I had to make very quick decisions, that most people wouldn't want to be in that situation. I had to think about my daughter. I had to think about my future as a clinician. And after having a discussion with the orthopedic surgeon, I decided to go ahead and proceed with the amputation the next day.
Wow.
And so, you don't really have a lot of time to wrap your mind around what is happening or how your life is changing. You're just thinking about, what can I do now to preserve what life I have left? And so that shifted my mindset. I thank God I had the amputation that I did. It saved my life. I was able to go on to inpatient rehab and get a prosthetic and start to walk and resume my life within the next month. But that moment made me stop and think about, what matters to me? Who am I outside of being a physician? And what does that mean? And so I kind of went through an identity crisis, but also reinvention. I had to reinvent my career and say, I need to prioritize my health. I need to, take time for myself. So during that time period, I transitioned to non-clinical and started doing more utilization management, more consulting, which I had already established, and medical expert work. So that allowed me to still practice, still provide for my family, but also to heal and recover during that time, because it was a transition. Even though I received a prosthetic and healed, I still had to learn how to walk. I had to learn how to drive. I learned how to become independent again. And also I had to, for lack of a better term, prove to the medical community that I could go back and practice. And so, believe it or not, 3.1% of physicians are disabled. And a lot of capacity and capability are based on, certain things. And I don't know, my medical degree didn't go away. My years of experience didn't go away because I lost a limb. They were all still there, and I'm still capable and able to take care of patients today. Some people may disagree with that, but I'm doing that every day. And I think I've proven them wrong in that sense. And so I had to change my mindset. And I think others need to change their mindset that, tomorrow is not promised. It could be a corporate reorganization. It could be disability. It could be an illness. It could be that you have to become a caregiver for someone. Life situations happen. And so what are you going to do to prioritize? A career is important, but it needs to be aligned with your goals and your values so that it can be sustainable for the long term.
Wow.
That's really key.
Yeah. Well, thank you for sharing that. And, sorry that you had to go through that, but it sounds like, as you mentioned, that kind of reinvented you. It kind of made you realize the fact that the identity of a doctor is fragile, and it helped you rebuild the life that you really wanted to have. And realize that, hey, that self-worth in the career is not necessarily what really matters, long term. Gosh, I can't imagine going through something like that, but I'm really glad that you had the clarity. You're able to come out on the other side and really do absolutely amazing things, and not let the fact that you experienced that impact your ability to practice medicine and to live life how you want to. And so thank you for sharing that. It's very inspirational for everyone. And, I hope folks take away from that segment the fact that, like, hey, let's not wait until we have something that is that detrimental that happens before you realize what really matters, and start living life today, and maximizing that, because we don't know how many days we have left. So thank you for sharing that. And I know that that probably has helped a lot with your coaching and helping to navigate burnout and career transitions for other physicians. Have you noticed any similar themes or more consistent themes amongst the physicians that you're working with as they're navigating burnout, career transitions, identity? What does that look like?
Yes, definitely. I mean, I act as a coach for the person that I needed probably 5-10 years ago, to be honest with you. And a lot of the same issues and, things I was grappling with, my clients and coachees deal with. And I work not only just with physicians in active practice, but I also work with medical students and pre-med students, because I think it starts early. As future physicians, they need to be thinking about their career identity they need to be thinking about burnout and developing tools and strategies to become resilient. So I do a lot of work with AMSA. I do a lot of work with my medical advising and coaching that I do with students, but in residents and fellows, but also attendings, like ourselves who are actively practicing. And a lot of the themes that we deal with are the same: burnout, identity crisis, lack of fulfillment in their job. A lot of people think, oh, I'm a surgeon, or I'm a internist, or and that is what defines you. But there's more than what defines you than what kind of specialty you practice. You are a multifaceted person. And so I think when people become dissatisfied with their careers, it's because there's a values energy mismatch. Yeah. And so you have to really spend some time doing a self-assessment and figuring out, who you are, what you want in life, and how do you want to achieve that, and setting those goals. So I help a lot of physicians who may be dissatisfied with their career redesign their careers. You don't have to leave clinical medicine to be happy. But you can also pursue non-clinical. There's so many options that I think most physicians are not aware of, unfortunately. They're not aware that their medical degree is not the ceiling, it's the foundation that they can use as a launching pad to go into pharma or industry or medical consulting or medical expert work. They can redesign their career and do, instead of private practice, they can do DPC or concierge medicine. They can do telehealth or telemedicine. There's so many options, and the sky is really the limit, right? Whatever you can conceive, you can achieve. And I think that I just help guide them towards that. And
that's beautiful.
So I'm really a career strategist. You tell me what you want to see, what your ideal, job role is, what matters to you. And then we set forth those steps to achieve it. And I think one of the things that is so important is having multiple streams of income, because you're not locked into one thing. You have that breathing room. And I think it allows you to practice medicine with more breadth and freedom and autonomy, because you love what you do. You're doing it because you love what you do, not because you have to. And that's the difference. That's the mindset shift that has to happen.
Yeah, and that is huge. And I could not agree more with everything you just said. And I think a lot of times as physicians, we get trapped with like that golden stethoscope, if you will, and it gets really, really difficult to think through, okay, what are some other ways I could practice, or how could I shake things up? And there's a lot of fear behind that. But if there's one thing that I've realized is there's plenty of doctor jobs. Not a day goes by where I don't get a phone call from multiple people asking me about a job. And so, it can always be something where it's like, hey, maybe this is just a season of life where locums makes more sense, or being a float provider. Like right now, I'm a float provider and I love it. I practice medicine 1 to 2 days per week, and it's great. And I have all that flexibility and autonomy, and I really love practicing medicine still because of that. And but worst comes to worst, if things all went to hell in a handbasket, I could go get a job tomorrow working full time. And so just having the courage to take that leap is really, really important. And I think something that folks struggle with from that perspective. Why do you think it's so difficult for physicians to imagine doing something outside of traditional clinical medicine?
I think it's how we've been trained, first and foremost. I think a lot of us don't realize, or we're not exposed to what those other opportunities and career paths are. We're trained that we're going to finish our training and take care of patients until we retire. But there's so much more that you can do, and our careers are not really linear when you really think about it. And I think also the fear is, there's a lot of fear, the fear of the unknown, the fear of what if I failure. But I also think that not having a strategic game plan is also important. Just how you plan for retirement, you have to plan for a career transition or pivot. And there are trade-offs, So if you pursue non-clinical, you may make, depending on what area you go into, what industry you go to, you may make a little less money, but then you also may have some trade-offs where you have more freedom or flexibility, less call. And so you have to look at those things, very closely before you make that transition. Money is not the only thing, the only commodity that matters. Time is also important. Spending time with family, having quality time, being able to pursue other interests that you may not have had the time to because you're busy so much clinically. So when physicians start to see all those possibilities and they start to maybe explore those possibilities, then they start to see that it's not so daunting or intimidating. And if you're not happy, you could always transition back to clinical. That's always in your wheelhouse at all times.
Yeah, absolutely. I love when you said the medical degree is the foundation, because you can always go back to that. And so I love that. What have been some alternative income streams or alternative pathways that you've taken that you've really enjoyed, and how has that impacted your fulfillment?
Well, lots of things, because I really have a truly hybrid career now. So I do clinical, non-clinical, and entrepreneurship. So some of the things that I do real estate, which I love. I've just really started to get into that recently. I also love entrepreneurship. So I have a coaching business. I have a publishing imprint. So I am publishing my own memoir and other books that I've written to help other physicians navigate this career transitions that they are maybe interested in. But I also want to open up that forum to provide other authors a means to publish their own transformational stories as well. Because I think, having a voice is important. I also do a lot of work with the Amputee Coalition locally and nationally, because I am an amputee. And, I think educating and providing awareness to the public about disability, about physicians with disabilities, is something that I'm really a champion for now, that I really enjoy. And then I also have a medical practice. I do medical, I have a medical practice here in Dallas. It's mostly telehealth, but I also see patients in person. And I still get that joy of, that patient, face-to-face patient encounters, interacting with patients, helping them with their chronic medical conditions and acute conditions, because I also do urgent care. So I really get the best of both worlds. I get to do, flex my entrepreneurship muscle and make an impact for fellow physicians. I also get to help other healthcare professionals like nurses, nurse practitioners, other high achieving, because burnout is not exclusive to medicine. It is in career reinvention and clarity. It's not, engineers, attorneys, entrepreneurs, all of us may deal with burnout. And so I feel like I can help all of those people with the coaching that I provide. And of course, our future physicians, can't leave them out, because they are the future. And being resilient starts with, being mindful, being intentional about the choices that you make in your life, personally and professionally.
100%. That's amazing. It's so cool to hear about all the different avenues and all the different things that you've done, because for a lot of folks, I think they don't necessarily understand that that's possible. And so that's part of the reason why I love the podcast so much, is getting to see all these really cool just paths that different physicians have taken. And it really opens up my mind, and also hopefully folks that are listening as well. It's like, hey, you can do this too. It's possible. Dr. Hooks has done it. And so that is amazing. Well, tell us a bit about the real estate, right? So we obviously love real estate on this podcast. You said you're falling in love with real estate. What does that look like for you as you've gotten into the real estate game?
So the real estate game is very interesting. I'm just really learning about it and getting research and starting to invest. in homes here in the Dallas area and Atlanta area. With some of the investment properties I work with are with groups. So, investment groups. So we pool our monies together to invest in properties for families and things like that. So I really like that. And I'm learning so much about investing because it's a different type of investing than when you're investing for retirement or something like that. And I feel like it's making an impact because we're providing, quality homes for families to live in. We're doing the renovations and keeping things up to standards, so that families can really grow. Your home is so important, right? It's where you live, it's where you grow, it's where your family grows. And so I really enjoy that aspect of things and learning more about financial things when it comes to real estate. And so I feel like that's kind of teaching me more about, financial literacy and equity and things like that. And so that's something that I'm just new to learning about, but it's something that's really exciting, because, when you're learning something new, and it's always kind of cool how, you're learning something, you feel like, oh, I'm not an expert in this, but you don't have to be an expert in this. The thing is with investing, sometimes you can work with other people that are the experts, and you start to learn, what deals, what investments are solid and which ones may be a little bit more riskier, but also you're learning about, how investments work, how real estate works, how that works, and utilizing and turning over those investments into other properties. So you get the benefits of the taxes and things like that. So I feel that that's very exciting. And for physicians who are high income earners, real estate is an excellent way to invest that I think a lot of physicians don't tap into, unfortunately.
Yeah, absolutely. Luckily, more and more are getting into it, and
Yes.
and I'm grateful for that. And there's just a huge opportunity in the real estate space, and I agree with what you mentioned too. That fulfillment of like providing great housing, or for us, it's like we invest heavily in residential and assisted living, and providing optimal care for seniors is just what it's all about. And having the opportunity to do something where that purpose and that profit are aligned is really really helpful, especially in hard times too. You always have that goal to look out for. So I love that. What are some non-clinical avenues that you would say are things that you would encourage physicians to consider? You had mentioned a couple: consulting, I think IMEs as well you had mentioned. What are some other things that you would say if physicians listening to this and are thinking, hey, I want to dabble in the non-clinical world? Are there any that stick out top of mind for you?
Yes. I say the top 3 or 4 non-clinical career opportunities that physicians can get involved in right away are medical consulting, which can include medical expert work, which I do both of, and then also utilization management, where you can either work for an insurance payer or you can work for a healthcare system as a physician advisor and review cases and make determinations. You can do that remotely. It's great income. It's great. You really get to learn the business side of medicine, how insurance works. And then I think the final thing is pharma and biotechnology. That's a real growing industry where physicians can, help with what's the cutting edge of medicine, right? Innovations in medicine, medical devices, medications, gene therapies for cancer. There's so many things. And we need physicians to be involved in that. I think a lot of physicians think that you can't get into these non-clinical avenues because of your medical degree, but that's exactly why you are qualified to get into these non-clinical career opportunities, because of your medical degree, because of your medical experience. But it's just transferable skills. So the same skills that you use every day to take care, treat, and diagnose patients, you're using them in a different way in the non-clinical realm. And so that's the mindset shift that physicians need to get into. As a medical expert witness, I'm giving a medical opinion. I'm explaining medical terms to an attorney, to a judge, to a jury, to see if there's negligence or, and a lot of times physicians aren't necessarily at fault. A lot of times when I do medical expert work, when I do case reviews, I'm actually saying, bad things happen to this patient, but there's no causation. Mm-hmm. There's no deviation from the standard of care. So that protects the medical community because there has to be a medical expert opinion on what is the standard of care. Was there any negligence or things like that? And in most cases, there isn't. And most cases are settled. Over 90% are settled. Surprisingly, people think that most cases go to trial. They do not. Mm-hmm. So the role that I play, whether I'm on the plaintiff side or the defendant side, is really to give the truth, right? The medical truth. What really happened in this circumstance? What happened to the patient? Is this something that could have been prevented or not? Why? And giving my medical expert opinion. Sometimes that doesn't jive with what the attorney thinks is right, the case. But I have to give my medical expert opinion. So I'm not influenced in any way to go with one side or the other. I'm just looking at the facts of the case, and I'm utilizing my medical expertise to do that. So that's something that I used every day, taking care of patients. I'm just applying it in a different way.
That is awesome. If folks are interested in trying to find some of those opportunities, are there any good resources or websites or anything that you'd recommend from that perspective?
Yes. One of the main things that I recommend is that you bring the opportunities to you. That's what I do as a career strategist. So a lot of those things are involved with being prepared. You need to change your CV, your curriculum vitae. Instead of maybe the traditional chronological clinical, you need to do a more functional clinical curriculum vitae, which focuses on skills. So, case management, case reviews, things like that, clinical decision making, writing reports, excellent communication skills. So things that we do every day, but we don't really write down or, identify those things that we're doing every day. And the other thing is I think optimizing your LinkedIn profile. Part of the reason why I get so many non-clinical opportunities every day, recruiters just reaching out to me, is because I've optimized my LinkedIn profile. And that's one of the things that I do as a coach for physicians. You're interested in a career reinvention. You decide, I actually have an AI tool that I've created that based on a survey that you take, a questionnaire, we can decide what the top 3 non-clinical careers are and how you can strategize to position yourself for that. So what happens is that the recruiters start reaching out to you because you have positioned yourself in a way where you get noticed. And also, I think the third piece is interviewing. You need to be prepared for interviews and know what these jobs are. So you need to do research. You need to understand what utilization management is. What do they do every day? What are their likes or dislikes? So you can do informational interviewing with other people in the industry, networking with other people in the industry to learn what the day-to-day is like, to see if it's a job that you would like to do. And then once you have a clear sense of that, then you start to apply an interview. And I have tips on how you can interview successfully and land jobs. A lot of my clients make a transition, and it does take time. But if you follow some of the steps that I provide and position yourself, I think you can transition sooner and quicker. And I also think that a lot of physicians need to not think it's all or none. So when I transitioned into non-clinical, I still was working clinically because I had bills to pay and mouths to feed. And so you can do a gradual transition. Maybe you do a per diem job, but you still work clinically to provide your needs, and then transition once you find a role or once you feel that it is a good fit. Don't put your eggs in all one basket.
That's great. That was some really fantastic tips and certainly helpful for folks. And I agree. And it's awesome too, as you're starting to get some of these alternative income streams set up, like then you're able to peel back the things that you don't enjoy as much. And then before you know it, you've really designed the life that you love and the career that you love. And you're maximizing time with family and things that you really enjoy. So that is incredibly important. As we're getting closer to wrapping things up, I want to talk about your memoir, Fire to Freedom. Why that title, and what does freedom mean to you now?
So the reason why I named my memoir Fire to Freedom is really because I went through the fire. I went through a very difficult time in my life, a very challenging time in my life that really forged me into the person that I am today. And so that's the freedom part of it. Most people would say, well, going through something like that would destroy you. But it actually really revealed who I was as a person, as a clinician, as a mother, as a human being. And it helped me prioritize things differently and to really have intention and purpose with what I do every day. I still have the same stressors in life that we all have, but I make a choice to say no to certain things, to set boundaries, to really pursue opportunities that are in alignment with what I really want to do in my life. So I have a very clear vision now, and I want to help others in that vision achieve what they want to do. That's the most empowering part of it. So my memoir, I hope, will resonate with people because it speaks on so many different things that we all deal with: burnout, identity crisis, trauma, resilience. And so hopefully, as you read my memoir, something will resonate with you. You'll take some piece of that, of my life and what I've learned, and it'll resonate with something maybe you've dealt with in your life and will help you with your own transformation, because change is inevitable. And I really think that people need to give themselves permission to evolve. We're not going to stay the same in life. As we age, as we get older, as we go through different milestones in life, we are going to have different priorities, and that's okay. It's okay to change. And change isn't always bad.
That is so good. When is the book coming out for folks to be on the lookout for it?
So the book is going to be launched September 23rd, 2026 on Amazon, Barnes & Noble, Ingram Spark, audiobook platforms, and you can also purchase it on my website. So I'm very excited about it.
Yeah, congratulations. That's a huge milestone and very, very exciting. And hard to believe September is going to be here so soon. This year is just flying by. That is awesome. Well, as we wrap things up, if a physician is listening right now and they feel burnt out or trapped or convinced that they've built a life that they can no longer sustain, what's some parting shots that you would want them to hear?
I would want to say that you're not broken. If you feel that you're stuck or burned out, there's always choices. Burnout is a signal of something that you need to change. And so if you're interested in learning more about how to change that, I think, coaching can be very effective for physicians who need the answers. A coach is kind of like a co-pilot situation. The coachee is the pilot, and I'm the co-pilot. The answers that you are looking for inside of you, I just help draw that out. I just help you figure out what you want to do and help you achieve it. Set those goals, achieve those things that you're looking for step by step. And so when you have that roadmap or that flight plan, you can go to your destination, safely. You can get there safely because you have a guide. And that's what I do. So if you want to learn more about what I do as a coach, you can go to pinnaclebusinessacademy.org. And on my website, I talk about the different programs that I have. I have 3 different programs: Career Reset, which is more for burnout and, gives you kind of a jump start into a burnout recovery plan and building resilience and mindfulness. career pivot and clarity, which is where you kind of learn and explore different career options and start to prepare for a pivot if you decide to. And then the career pathways, which we start to really explore. So if you're interested in one particular career pathway, like locums or utilization management, I can walk you through step by step how to transition into those different industries. And I not only share my experiences, but I also have other physicians that share how they have transitioned. And so I think that knowledge helps people empower them, but also educate them on what the next steps are so that you're not afraid and not doing this alone.
That is so good. Yeah, absolutely, folks. Be sure to check that out. We'll make sure we put the links in the show notes as well. Dr. Bertina Hooks, this has been very inspiring. Thank you so much for what you're doing all across multiple different communities, the physician community, the amputee community, medical students, residents, all the above. You're doing big things. So excited for you and for your book, From Fire to Freedom, to come out in September. So folks, be sure to be on the lookout for that. Dr. Hooks, thank you so much for coming on the Physicians and Properties podcast tonight.
Thank you.
Awesome. We'll go ahead and wrap things up with that. It's been Dr. Bertina Hooks and Dr. Alex 𝐓𝐢𝐻 with another episode of the Physicians and Properties podcast, signing off. Hey, real quick, if you're still listening to this, I'm assuming you got value from it. So I need your help specifically. My 2-year vision with this podcast is to help 100,000 physicians learn how investing in real estate can give you the freedom to practice medicine and live life how you want. There are 2 main ways that a podcast grows. One is through ratings and reviews, and the other is word of mouth. If you can please leave me a 5-star rating and review on Apple Podcasts and Spotify, as well as send this to 1 to 2 friends that you think would get value from it, we can reach the physicians that we want to reach. Thanks in advance, and talk to you on the next episode. Please note that the information shared on this podcast is for informational purposes only. It should not be considered financial or medical advice. The views expressed on this podcast are those of the host and the guest and do not necessarily reflect the views of the Department of Defense or the United States Air Force.